Hello and welcome to our channel. Today I am going to talk about 5 things everyone should know about the coronavirus outbreak. As disease spreads in the US, precautions are critical. While some news about the coronavirus has been evolving, doctors say the best advice is to follow public health directives and take care of yourself. Covid-19, the respiratory disease caused by the new coronavirus, continues to spread around the world and the United States. Many countries are asking people to stay home and self-quarantine. The World Health Organization has officially called the disease a pandemic, which means a disease outbreak occurring over a wide geographic area and affecting an exceptionally high proportion of the population. The United States has declared the pandemic a national emergency, and states throughout the country are taking major measures to slow the spread of the virus. According to the World Health Organization, globally there are more than 5 lakh confirmed cases of people with COVID-19 and nearly 25,000 people have died from the disease. In the US, numbers are changing daily as different parts of the country experience different levels of COVID-19 activity. All 50 states have reported cases. Meanwhile, people in the US are facing significant disruptions, including unprecedented cancellations, postponements, and shutdowns of everything from school to religious services as report of community transmission. States and cities across the US are asking or ordering people to stay home. President Trump has activated the National Guard to assist California, New York, and Washington, which have been hit especially hard. Coronavirus is a virus that scientists haven't seen before. Animal-to-person spread was suspected after the initial outbreak in December among people who had a link to a large seafood and live animal market, which is in China. Scientists and public health officials are working to find answers to key questions about the severity of the disease and its transmission. I'm gonna explain 5 things you should know about the coronavirus outbreak. The first thing, information about COVID-19 is still evolving. The name coronavirus refers to the spikes seen on the surface of the virus. Coronavirus causes respiratory tract illness that range from common cold to such potentially deadly illness as severe acute respiratory syndrome, also first identified in China and Middle East. According to the Centers for Disease Control and Prevention, this is the first pandemic known to be caused by the emergence of a new coronavirus. Novel influenza virus caused 4 pandemics in the last century, which is why the response to COVID-19 is being adapted from the existing guidance developed in anticipation of an influenza pandemic. Second point you should know. Experts are taking steps to address COVID-19 and reduce infections. Proper testing that is made widely available will be important in understanding how the disease is transmitted and the true infection and mortality rates. In addition to COVID-19, testing being done by the Centers for Disease Control and Prevention in the US, state and local public health labs in all 50 states. Meanwhile, China is currently testing a number of therapeutics in clinical trials. In mid-March, the National Institute of Allergy and Infectious Diseases announced the first testing in humans of an experimental vaccine, but it could take at least a year before such a vaccine is available. Third thing you should know. If you feel ill, here's what you can do. So far, information shows the severity of COVID-19 infection ranges from very mild, sometimes with no reported symptoms at all, to severe to the point of requiring hospitalization. Symptoms can appear anywhere between 2 to 14 days after exposure and may include fever, cough, difficulty in breathing. You should call your medical provider for advice if you experience these symptoms, especially if you have in close contact with a person known to have COVID-19 or live in an area with ongoing spread of the disease. Seek medical attention immediately if you experience emergency warning signs, including difficulty in breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or ability to arouse, or bluish lips or face. Fourth point you should take note. There are things you can do to protect yourself. As with a cold, a flu vaccine won't protect people from developing COVID-19. However, while doctors learn more about transmission, the best thing you can do at this point is take care of yourself the way you would to prevent yourself from getting the flu. You know you can get the flu when people sneeze and cough on you, or when you touch a doorknob. Washing hands, especially before eating and touching your face and after going to the bathroom, and avoiding other people who have flu-like symptoms are the best strategies at this point. The Centers for Disease Control and Prevention also recommends the following preventive actions. Wash hands with soap and water for at least 20 seconds. Dry them thoroughly with an air dryer or clean towel. If soap is unavailable, use a hand sanitizer with at least 60% alcohol. Stay home if you are sick. Avoid touching nose, eyes and mouth. Use a tissue to cover a cough or sneeze, then dispose of it in the trash. Use a household wipe or spray to disinfect doorknobs, light switches, desks, keyboards, sinks, toilets, cell phones and other objects and surfaces that are frequently touched. It may be also important to create a household plan of action. You should talk with people who need to be included in your plan. Plan ways to care for those who might be at greater risk for serious complications. Get to know your neighbors. Make sure you and your family household plan that includes ways to care for your loved ones if they get sick. This includes planning a way to separate family member who get sick from those who are healthy if the need arises. As for the masks, there is little evidence supporting their widespread use for people who are not sick. Masks may provide a modest degree of protection against fluids, including spray from a cough or sneeze, and they provide some filtration of the air. But since the masks do not provide a tight seal around the wearer nose and mouth, much of the air inhaled and exhaled remains unfiltered. However, the Centers for Disease Control and Prevention does recommend face masks for people who have symptoms of COVID-19, as well as for healthcare workers and others who may be caring for them, and people who are caring for them should wear masks. Step number 5. Precautions remain extremely important. Since threats like COVID-19 can lead to the circulation of misinformation, it is important to trust information only from reputable health organizations and government sources such as the Centers for Disease Control and Prevention and the World Health Organization. The Centers for Disease Control and Prevention says the disease can spread between people who are in close contact with another victim within 6 feet. While it is important to maintain distance from people who are sick, many experts are also recommending everyone practice social distancing and avoid large crowds whether they are sick or not. Guidelines are also evolving as doctors are learning more. While no one knows for sure how the situation will progress around COVID-19, studies of influenza have shown that pandemics begin with an investigation phase, followed by recognition, initiation, and acceleration phases. The peak of illness occurs at the end of the acceleration phase, that is followed by deceleration, during there is a decrease in illness. The length of each phase can vary depending in part on the public health response. Efforts to reduce the impact of the disease are especially important in the absence of a vaccine or treatments, and officials are approaching this in a variety of ways. This has included major restrictions on travel along with recommendations to postpone cruise ship travel plans. That's it for this video. If you find this video useful, please don't forget to like, comment and also share this video with your loved ones. Take care of yourselves.